They're counting us down.
5, 4.
Okay, so we are doing our first podcast live, which is streaming on YouTube, and we're recording it, so we'll be able to put it out later on Instagram and, of course, TikTok, which we have an up-and-coming, famous, soon-to-be even more famous TikToker. We have Rachel Connelly, who you started a TikTok channel about 10 days ago. You had a cool idea about being a big sister in advice, and you have over 210,000 subscribers like that and growing just like that.
Yeah.
And then we have Dr. Heather Woolery-Lloyd from Miami. She is a board certified dermatologist. You've probably seen her on a lot of TV shows. She's been on all of them as a medical expert, as I mentioned, dermatologist, wellness expert, women's health issues. So you're going to be an amazing person chatting with us today on topics. And we also have from As Not Seen on TV, our very own Dana Conklin, who also happens to be a big sister. And has 3 younger sisters, which brings us to why we're here today. Rachel, tell us about your idea, what you started doing on TikTok that's just blown up, and then we'll just jump right into it.
Okay, yes. So about 10 days ago, I was sitting in my car after I went to the gym, and I saw these girls, and they're just hanging out, and I don't know if this is TMI or however, whatever, but, I could see the pad lining in her leggings, and I was like, you know what? I did the same thing up until I was 15. No one told me, I didn't know you weren't supposed to wear those when you work out, or it was just a preference, but other people could see it. And I was like, I wish that I had a big sister to tell me all the things that I didn't know. And so, I just thinking about it, and I was like, I should make a TikTok. Even if only a couple girls see it, it'll just mean the world to me that I can help other girls. Every girl kind of goes through the same thing. So I make 2 videos. One of them's about washing your face after you brush your teeth, and the other one is just an introductory video. And I wake up and I have 10,000 followers. All these girls are telling me, they're like, thank you so much. I have a single dad, or my parents are divorced, or I don't have older sisters. And they're just like, this means the world to me. And then as the days go by, I have a video that goes and hits 2 million views, and I gain 100,000 followers. And these girls are like, thank you so much. And for me, it's I don't even care about the amount of followers as long as this is helping girls who don't have older sisters and I can be there for them. That's what really just means the absolute world to me. So that's just why I made it and everything that's happened so far.
And we should share that you have a slightly big family. You're one of 10.
Yes. I am number 5 out of 10. And my older sisters, one of them's about 6 years older than me and the other one's 4 years older than me. But so whenever there's kind of an age gap there. So when I was going through puberty, they were already kind of finishing it. And I wasn't just super close with them growing up. And so I had to kind of figure these things out on my own, and I was super shy, and I was uncomfortable with the topics, and I didn't know where to go. And so, and at school, yeah, you learn about it, but you're not going to ask a question in front of all your classmates or there's boys there or whatever. So I just had to learn these things on my own. And so it just means the world to me that I can help these girls who are 12, 13, 14, who are uncomfortable to ask, too scared to search, don't have access to a gynecologist, or whatever, and I can just be there to help them the best I can.
And the range of topics, I mean, it's broad, very, very important. And, you even said right off the top, I don't know if this is TMI, you said, and we're going to get into all of that for real. And that's because that's what's important. And that's why, again, a lot of people, when we've said, what is this, that this young lady, she's 19 and she's sitting at her bedroom at home with her, you can see the white wall where you're doing it from, and 200 and something thousand followers, all organic, not put it. People just can't get enough. We're looking at the replies, the engagement. So, Dr. Heather, as an expert on women's health, wellness, everything else, what do you think about what Rachel's doing and the response? You're on TikTok yourself. You're actually sponsored by TikTok to put educational medical content out there. What do you think?
I think, the education that Rachel is doing is so important because there's a lot, when being a young girl is embarrassing. Like there's so many things that you just are like, is this normal? Is this not normal? And just having someone who's like really relatable and normal, basically. And in some ways, to be honest, not a doctor, not your parents, just a person who's been through it all, telling you, okay, you know, do this, don't do this, or it's okay if this happens, that's normal. I think it's so valuable because in a way, I think that sometimes kids, especially now, are a little bit more isolated, and things that you might learn, you know, by, you know, being in school all day or being around tons of people all the time. Now you're kind of by yourself, you know? So I think it's such a great thing. Just telling young people who don't really have, who have normal questions but don't know they're normal. That's the biggest thing. I do a lot of laser hair removal, so I remove a lot of unwanted facial hair in women, and every single woman is like, is this normal? And I say, I treat thousands and thousands of patients. It's okay if you have facial hair, it's completely fine. So I think that with a lot of women's issues, and especially for young girls, it's very isolating and you feel like you're the only one. And Rachel does a great job at, you know, opening up everybody's eyes.
And you know, out of the corner of my eye, because Dana's across from me, I'm looking at the monitor, and I have to tell you, as Rachel speaking, and then as Dr. Heather, as you're responding, I'm seeing this. Now, Dana has worked with me at our agency for 4 or 5 years now, and she's also from New Jersey, like myself. So that means that most of the time I'm used to this, and like, you know, like, you know, and I mean, she is just, her head is like not stopped. And I know that like about 10 days ago, she was one of the first people I sent your TikTok to when someone sent it to me, because I knew she was a big sister, and you've just kind of gone all in on it and been following. And, you know, what do you think about this and the experience you've had in watching?
Yeah, the biggest thing you brought up, TMI. Is there TMI in life? Sure. Puberty, when it comes to advice or tips, there's no such thing, because when you're the last to know something, that's embarrassing, especially at a young age. And, you know, sharing things that might be embarrassing for you to save somebody else, you know, it just spreads the word. I think it's huge. And coming from somebody who didn't have an older sister, you know, I would have to write notes to people in class, girls that were older than me, just to like find out what's normal or not. I mean, at least people have someone like you now. So thank you.
Yeah, that is a thing. And I know, you know, you were the big sister, and you kind of helped raise 5 siblings, boys and 2 boys, 3 girls. And you were, you know, what's that TV show? Is it called Shameless or something? And
yes.
And I remember at one point you even joked, and we're like, because in the TV series, there's like the older sister who kind of
Fiona.
Yeah, takes care of all of the kids and keeps them alive, and her, you know,
I'm Fiona.
and you used to refer to yourself as that. But that is a massive amount of responsibility growing up, and not an easy thing. And then you don't have any, and the people that you're maybe passing notes to in school, well, who knows what information they're giving back about these topics? You know, it's not family, it's not. So
one thing I was saying to you the other day is I didn't even know of the word dermatologist growing up. I mean, I didn't know it was something to look for or ask about. I just thought the skin you have is the skin you're in, and I was never really taught tips or tricks. So
yeah, and
I hear that a lot. A lot of times patients will come in, they're in their 20s or even their 30s, and they'll say, you know, I've never been to a dermatologist before. This is the first time I've been to a dermatologist. And again, thinking like, and that is actually not uncommon. I think it's common not to see a dermatologist and kind of get all of your skincare advice from friends and family. And you know, people say put, you know, apple cider vinegar on this and alcohol on that.
Oh my goodness, yes.
So I think that's not uncommon. I don't feel like you are rare. I think in my practice, I see that all the time.
We're going to jump into some of the different topics, and I will say that, you know, just to get it all out there, which is the whole purpose of Rachel's channel and having Dr. Heather here, we were going back and forth last night, and some of our other producers, on a bunch of the questions, because Rachel reached out to her TikTok audience and said, hey, I'm going to be doing this live stream on YouTube. What are some of the other topics you'd want to ask? They're great. We put them all together today, and then even some questions from individuals that Rachel said she would answer and go through as well. And as we were sitting there, it was probably 9 o'clock last night, and again, talk about being comfortable and asking things. the questions would go back and forth, and I'd say, okay, this is a question for Dana to bring up. I'm not asking this one. Nobody wants to hear this come from me. And yet things that you would never ask, your brother, your father, any male in your life, absolutely should be and needs to be comfortable. And that's why I'm really happy that we have everyone here today. And I know you mentioned even how this might shape how you interact with your 3 younger sisters as well and communicate. And so why don't we jump into some of the topics? But Rachel, what is there like a universal topic that you have found that you hear the most of, or a thematic where it's kind of like so many girls are just all in the same boat on this topic?
Yeah, so there's 2 or 3 that I think is just so many girls, and these are the 3 that I was always like, one, I would say they're like, what is the stuff in my underwear? Like, what is discharge? Is this normal? What color should it be? What does it smell like? What should it smell like? What was your experience? And that one is just like, it makes me kind of sad that they have no idea what's going on, and they have no idea this is normal, and they become ashamed of their bodies. And so for me, it's like, it's kind of an uncomfortable topic, because I remember being 12 and 13 and you're like, what is happening to my body right now? Or even earlier than that. And so that's one that is always asked, is like, is discharge normal? And I'm like, yes, absolutely. That's completely normal. And then another one is, they're like, do you have to shave down there? Is there a correct way to shave? Is there a wrong way to shave? Things like that. And it's just like, there's really not an outlet to go to, nobody really talks about that. When you see a razor commercial, it's all the legs, and the armpits. There's nothing, obviously they can't show that, but there's not a guide or a tutorial out there on how to shave that correctly, because, if you do it wrong, you can get a rash, ingrowns, like all this stuff. And it's really, really uncomfortable. And a lot of girls think, oh, if I don't do that, then that's not normal. Or if I do like not shave down there, then like blah blah, like just whatever. And like that to me is just like, well, obviously it's a personal opinion, but still, like, there's not an education out there on how to shave down there correctly, if there is a correct way. And so for me, it's hard to like, talk about it, because on TikTok they have guidelines, and you say certain things, do certain things, it gets taken down. So that's something that they were asking me to ask Dr. Heather, is because they were like, how do you avoid razor bumps and ingrowns and things like that?
Just to clarify, I don't think you're going to get
hair.
taken down on our show. We've had mafia hitmen, we've had severe combat war veterans.
We have you.
And me. So I'm pretty sure if YouTube hasn't taken us down yet, this is a pretty safe forum. And thankfully, you're talking about a really important topic. We want Dr. Heather to jump in on that. But what's the age of the girls who are asking these questions, Rachel, in general? Is there a range?
Yeah, so my analytics show that most of my followers are 12 to 15-year-olds. I have a couple 10 to 11-year-olds, which is great. And then I have a couple girls that go up to 18, but that's usually the range, which is great, because those are the girls going through puberty. But it's also like, no one talks about how you're going to start growing hair down there, and when is the perfect time, or when is the normal time. And the thing is that is a often misconception, is like, there is no normal time to go through puberty. That's just when your body goes through it, and what happens. And I think that's just really frustrating me as an older sister, and having 2 younger sisters who've gone through puberty at different times, and them telling me that they get bullied for it, or people make fun of them, or things like that. And it just makes me so sad. And I'm like, this is why I do what I do, is to normalize that whether you're 10 or you're 18, this is completely normal.
Dr.
And
Heather,
so,
I'm sorry, Rachel, we got to overlap, but Dr. Heather, why don't you jump in? And I mean, what is that age range? What you would expect? What's your comments on that?
Absolutely, everybody's different. There's no one right time. It's really, there are girls as young as even 8 or 9 years old who have some early changes of puberty, and obviously, if it's really early, we go to the pediatrician and they do some testing, but in general, you could be totally normal and have some early changes of puberty, even in early elementary school or mid-elementary school. The vast majority of people go through puberty between the ages of 11 and 13, 14 years old. But there is no one time, you can be early, you can be late, and that's okay. That's completely normal. And the other question about the hair, laser, the hair, pubic hair, that is a huge common question I also see. And people, razor bumps and ingrown hairs are a big problem, and it's uncomfortable, it's itchy, they can get infected. And so I always tell patients, shave in the direction of growth, which is usually downwards, in the down direction, and shave after after the skin is moist. So usually in the shower is the best time to shave. Definitely don't shave when the skin is dry, because that's definitely more irritating. And then there are razors on the market that are designed to try to reduce the razor bumps, but there's nothing perfect. I mean, some people are really predisposed to razor bumps. The other thing, electric razors can be helpful with razor bumps. And then the last thing, which is what I do all the time, is laser hair removal. And laser hair removal basically eliminates the problem. Obviously, that's not free, that's expensive. So it might not be an option for young teenagers, although some young teenagers do come in for laser hair removal. But those are the tips I would say. Shave in the direction of growth, downwards when the skin is moist. Look for razors that are designed to treat razor bumps, or use electric razors. And how much to shave off, really, again, there's no standard, there's no standard look. And it's really just personal preference and the age to start. Again, most kids or teenagers start doing that a little bit later, like in high school. I don't know if kids really do it not as much, maybe a little bit, but not so much in middle school, but definitely by high school, kids are shaving in that area.
I was going to ask you, because I know you and I have daughters around the same age. I know that my daughter threatened me with death if I bring her up in any context, because she's 13 in this topic. But since you're a doctor and you speak better and they're more educated, what are some of the things that you say to your own daughter to make her comfortable? And do you find that even because you're still mom, I mean, you're a doctor, yes, but you're mom, that she might not want to speak to you?
Exactly like yours, exactly. So she does not want to hear anything from me, anything. Like, I could even just say the peep of anything that to her is somewhat, something she doesn't want to talk to her mom about. So I can't say from experience that I'm the source of her information, because I'll try my best, but she'll, run in the other direction and hold her hands over her ears.
She's reaching out on Rachel's TikTok for info. She's like,
yeah. I'm like, this is normal. I'm a doctor. She wants nothing to hear of that. So
it's good to know for parents and kids,
by the way,
that's normal.
That is completely normal.
Yeah.
Because I was the same way too. So, and my mom was a nurse.
Did you find?
Yeah, exactly.
Did you find, Dana, that you ended up using your own experience of not having anyone? Were you able to have a positive experience with your own younger sisters, and how so, or what was the story?
I was going to ask Rachel the same thing, if her actual younger sisters really listen to her, because it depends. I mean, when you try to instill something on them, they pick and choose what they listen to. The things that I really wanted them to listen to, they just would not. Sometimes you have to learn things on your own, but I find when they just watch you doing things, they kind of want to use you as a role model and copy you. But if you tell them what to do, it's really hard. That's why I love your TikTok page, because you're not their older sister, you're not their mom, you're not anybody that they know, so they immediately want to hear your advice.
Yeah, like you don't want to be told to do something, but you also want to know. I feel like that's just, at least for me, I don't ever want to be told how to do something, but I also want to know the information. So if I'm just watching someone to do it, I'm like, oh, okay, I'll do that. But the second they tell me to do something, I'm like, no, I don't want to do that anymore. But like with my younger sisters, it's total pick and choose what they listen to. And sometimes they won't even ask, and I'll just be like, hey, by the way, like when you're shaving, just make sure, like what Dr. Heather said, you're shaving the way the hair is growing. Like, and then she's just like, my sister's like, that was so random. But I know, like later she came around and was like, because she's 14. She was like, oh, wow, that totally changed. So sometimes as an older sister, you just kind of have to be like, hey, I know you're not asking, but I'm going to tell you anyways. So, but yeah, totally. It's a pick and choose. They don't really always listen to you.
So what are some of the other topics? Let's look down. I know that people have brought up that come up on a regular basis, but we know there are a lot of things that we're hearing and people writing in about were even mental health topics and hormones. And I mean, look, as Dr. Heather referenced, you can't miss it. I mean, we're almost a year into a pandemic where everyone's isolated more than before to begin with. So something that was already not an easy topic for almost any young lady, a girl, in that age range, now you're even more isolated, and potentially certainly additional mental health issues for almost all of us. So what would you say right now, and what are you seeing on your TikTok channel and also in your medical practice? What are you seeing in that regard?
I'm sorry, you cut out a little bit. What did you say?
Sorry.
Sorry.
In regards to mental health, what are you seeing? What are young girls, young women writing about to you and posting about on your TikTok?
So this makes me just like really sad because probably a year ago, maybe this wouldn't be a problem and girls wouldn't be struggling with this as much. But a lot of girls are going through puberty by themselves in their own home. They don't have the support of other women around them like they would in school and things like that, depending where you live. So a lot of girls, they just feel like a lot more awkward. They're stuck at home. A lot of girls would say, I have a single dad, I'm really struggling. They are becoming super insecure about their bodies, which I felt that going through puberty, but it did help having people around me. So people are like, I'm super depressed all the time. I can't even get out of bed. I can't take care of myself. There's no like nurses around at school. Like I would go to my school nurse and be like, hey, is this normal? But since they're not, and we're in a pandemic, they can't ask those questions. And it's just making me sad because I do know that hormones do play a huge role in our mental health. I was on birth control for a year and I got super severe depression. And a lot of these girls, I have to tell them, be like, hey, if you actually made a TikTok about it, because someone asked about my birth control, and I've gone through three different kinds until I found the one that was best for me. And I'm like, hey, you need to keep a journal and write and be like, hey, am I actually sad, or is the birth control making me sad? And then try to find another one, or am I actually angry or whatever? And that's what they're commenting. They're saying my birth control is making me feel really depressed or wanting to do self-harm, or I'm being suicidal. And this is just making me so sad because to them, they're on birth control for whatever reason, but they don't realize that they need to be on a different kind. And I'm sure, Dr. Heather, you see this a lot with women being on birth control. They just stay on it for a long time and not realizing they're not themselves. This is like hurting them. And I finally had to go through, it was almost like 2-3 years until I found an IUD that worked for me. And so
yeah,
I just see a lot of that.
I think most people, again, this is so important to share this because I remember many moons ago, I was on a birth control that had a lot of progesterone, and that can increase depression and weight gain. The biggest complaint I'll get in my practice is weight gain from birth control.
Yes.
The good thing about birth control is that it helps with acne. So a lot of my patients, will ask about that because it's a hormonal therapy for acne, but there are side effects. So you have to find the right one that works for you. And, again, personal experience is so helpful because I'll have patients come in who are having side effects from their birth control, and my patient population, which is around 25 to 45 years old, their number one complaint is weight gain, and also that emotional change. Depression can happen, especially with the progesterone-based birth controls. And having someone who's gone through that and said, oh yeah, that happened to me, and talk to your OB/GYN, and they could probably switch it around and find one that works better for you. It's so the sense of relief on someone's face when you can say, yes, basically to validate, that person's experience by saying, hey, it happened to me, I get it, is really, really rewarding. I think it's really important for us for everyone to understand that, it may not necessarily be the birth control because we are going through a pandemic and
Yes.
there's a lot going on right now. But definitely medications can influence it, especially hormonal medications can influence our mental health, especially.
But it's really, besides, it's certainly heartbreaking beyond, but it's scary stuff. I mean, what Rachel's bringing up, that young girls, in this age range, and we saw it. I mean, even in the last day or two on your TikTok, we saw some folks who wrote in, some young ladies asking you to address the topic of suicide, and we didn't not want to bring it up? I know we have a world-renowned dermatologist and we're going to get into skincare and everything else, but it felt irresponsible, we were talking about it, to not bring it up because it's so obviously such an issue that is part of the toll of the pandemic. It existed long before the pandemic, of young people going through puberty and all of the different changes and mental health issues, and now add 11 months of isolation on top of it, not being able to go to school, see your friends, even have access to a teacher who might notice something is off and let someone know. So the risks are so high. Dr. Heather, what would you say as the medical professional, first and foremost, to any young woman or person who is watching this right now and is dealing with depression?
So what I would say is that there's always help, and it's hard to feel like reaching out for help is an option, but that is always the option. And there are many, suicide prevention hotlines and many resources that young people can reach out to, just find someone to talk to, and let someone know, someone who you feel comfortable with know. So, and ideally an adult, because then if you really need intervention, which if you're having those thoughts, you do, and there are many, many things that can get you out of that situation that are really effective. Because remember, I always tell people mental health issues are medical issues. So if you had a problem with your kidneys or a problem with your pancreas, you would be like, oh, what is the medication to treat my kidneys or my pancreas? Or what is the treatment? What is the intervention? And our brains are the same way. And it's nothing to be ashamed of. It's nothing, there's nothing wrong with you. Just like someone who has, a problem with their pancreas and has diabetes, there's nothing to be ashamed about that if you're having mental health issues. And just reach out to either, if you're in an isolated setting, a suicide prevention line or these hotlines that are available for young people to talk, but also an adult, and just ask, I just know there's no judgment whatsoever. There are lots and lots of therapies available, and there's no difference between, depression and mental health issues than there is between other medical things. It's still a medical condition with excellent treatments. And the bad thing about depression, it tricks you into thinking that there isn't a fix, when ironically there is lots and lots of treatments that are extremely effective. So that it would be my advice, is to reach out to someone, preferably adult. And then for all of the teenagers, if you see signs in your friends that you're making you nervous, right? Again, reach out to someone, so that reach out obviously to your friend, but also an adult, to let them know, hey, my friend might need some help.
Yeah, and I would just say really quick, that's the whole reason I made an Instagram. I know I'm more TikTok based, but my DMs are always open, and I've actually had a couple girls come to me and say, hey, I don't have any questions, I just need, emotional support, and they're talking to me. And I just try to check in on them every day, be like, hey, I hope you have a great day today. And they're like, this means so much to me. And really, it only takes like 2 seconds on my part. But I actually had a girl tell me, and she was like, you checking in on me every day means the world, because my parents recently got divorced. They're not talking to me. I don't have any friends. I'm in quarantine right now, and there's nothing I look forward to. And I look forward to your messages every day. And I just think if people understood, even if your friends aren't having depression or things like that, just reach out, because it really does mean the world. And like, I know that when someone reaches out to me and it's just random, it makes my day. And that's also something, even if I'm not answering any questions for these girls, and they know that there's someone there emotionally that can support them like an older sister would, that would just mean everything to me. Because I actually had a friend a year ago pass away from suicide. It was really hard for me. And I just kept, kicking myself. I'm like, oh my gosh, if only I'd reached out. And that's what I think is so important. If people just started reaching out more, I just think it would help. Obviously, there are medications, like Dr. Heather said, that actually do help and cure these things. But just the little things that we can do as a non-medical doctor, just reaching out, it just helps so much.
Yeah,
So
I hope.
I totally agree. And then another thing, which is a big part of what I talk about on my TikTok, on my Instagram, is being out in nature, because I feel like we're inside of our house and we, never leave. And young people are in school all day and never get outside. And, even that has been shown to elevate all of the good hormones in our brain and chemicals in our brain that make us feel good. So, take walks outside. I live in Miami, so the weather is beautiful, but snow is pretty too. So get outside, get moving, exercise, all of those things help.
Yeah, and I actually made a TikTok on that about how every day, I mean, I have a dog, so I have to go outside for 30 minutes, but I just said, leave your phone, get off social media. If you have to bring your phone for safety reasons, listen to a podcast or something, but just go outside, because I know when I was struggling with depression, the best thing my mom told me was to get out of the environment that was making you depressed, just a change of scenery, so just go on walks. But yeah, I totally agree.
That is excellent advice. And actually there's lots of science to back that up. When we go outside, even looking at pictures of nature is positive for our mental health. So imagine just walking outside, looking at trees, hearing the birds, feeling the wind, all of those things really help. And exercise is a big one.
I would like.
I love how you just also, Rachel, reference so openly, that you've dealt with depression as well, and maybe still are, or what have you. But I think that's why so many young ladies are so comfortable opening up to you, because you're living what Dr. Heather, as the medical expert, is saying, that there is nothing to be ashamed of, there's nothing to be embarrassed about whatsoever. She's 1,000% spot on, and you're living that and showing that yourself. And Dana, I know that you have had some comments on this.
I just want to throw it out there that if you feel depressed and you feel sad and you don't feel okay, that is so normal. And for you to identify emotions within yourself, you're already ahead of the hard part. That's strength, to identify emotions in yourself. And I feel like so many of us are raised in society where you fall down and someone's like, it's okay, you're fine. What if you're not fine? Like, it's okay to feel. Be proud of yourself, work through it.
Yeah, one of the comments that, we've heard and have kind of taken on ourselves is that if you've been living through the last 11 months of this pandemic, as we all are, if you're not feeling sad, if you're not dealing with what some people might call a depression on some level, I don't know what planet you're living on. I mean, it's pretty hard going, man. And for a lot of us, I mean, it didn't pop up because of that. I mean, being sad is a human condition. And I think the fact that we're told opposite, or buck up, but without getting to the heart of it. And I want to add just, something that touched me just in the last couple of days on this topic was someone I noticed just started following me on Instagram, but what I saw just jumped out in their, what do you call it? Like, we have your biography and all your info and stuff. And the banner headline was suicide survivor, and a few other things that was tied to that. And I noticed that the picture of the woman was so happy and so vibrant. And I started to scroll down her feed and everything, and I sent her a message. I stopped everything I was doing. Part of it was it grabbed me because suicide has touched my own life very closely. Won't get into it here today, but it'll just take us way in a different direction. But it did move me, and I sent her a message, and 2 seconds later she sent me a link to her whole story and history on which she had posted on Facebook and was sharing with everyone how 14 years ago she survived a suicide, and how glorious her life has been since,
and how
thankful she is. And that's the only thing that I want to add on to what you guys have said so perfectly already, is that when they do studies and when they talk to the few people who actually survive suicide attempts of certain natures, and sometimes if people have lived and they speak to them, one of the very most common things they hear is, the second I did it or started to do it, I regretted it and wanted to stop. And thank God if they were able to talk about it afterwards, it means they lived and knew that. But that is so common across the board. So hopefully we have the phone number, and it's out there a lot, but it can never be said enough. We want to make sure when this topic's coming up, the National Suicide Prevention Lifeline, everyone can Google it, it's out there, but that's 800-273 8255, 800-273, 8255, or you can just go to suicidepreventionlifeline.org and to the expert, Dr. Heather, medically, and all of the experience that Rachel's seeing is tell someone, ask someone, and that's the most critical thing. What role do you guys think, because I think it is a fair segue, we hear it all the time, social media, in maybe, I'll go hard and say, in the harmful way. People are sitting there, and I'm not trying to condemn anyone in particular, but if in specific you're not feeling on top of the world and you're on Instagram and TikTok and you're seeing Kylie Jenner and, man, life is just spectacular, pandemic, I'm at a $40 million resort in Tahoe this week. And again, I'm not picking on her. I mean, truthfully, if I'd gotten an invite, I'd have been there with them. So I don't have any issue with trying to make your life happy and what have you, but let's be real. That ain't an option for like 99.99% of us. And what role do you both think social media can play on making these issues worse for people on that type of an example?
Dr. Heather, you can go first.
Sure. So there's lots of studies on that, and they definitely show across the board, universally, social media definitely can definitely decrease self-esteem and decrease even feelings of happiness. So especially aspirational social media where everybody is perfect and looks perfect, and those, I think, are the types of accounts that although that, that person is not intentionally trying to make people feel bad about themselves, but definitely just seeing that over and over again, only the positive sides of life, I think definitely affects people in a negative way. The flip side of that, and so basically the question is, what can we do about that? So one of the things you can do about that are follow people like Rachel, who tells you how it is, and it's very realistic. And that's one of the things that I loved about TikTok. I started on TikTok in July, and I just loved how real it was. It was definitely not, everyone's house is messy and it wasn't perfect, and everyone didn't have on makeup and, look like they were about to walk into a Hollywood premiere. And so I love the realness of TikTok. And also TikTok feeds you what you want to see. So I love funny videos and dogs and cat videos and stuff. So I go on TikTok to just laugh. I just laugh for 20 minutes straight because that's what, the algorithm is feeding me. So I don't want to say social media is all bad, but it is really, really, really important to disconnect. Really important to disconnect for a period of time every single day, and put the phone down, go for a walk, like Rachel said, do something outside, call your friend or your favorite aunt or your favorite cousin or, someone, because strong, positive social connections are what are most important and valuable for our mental health. So that would be my takeaway.
Before we
Sorry. And just sorry, go ahead.
No.
Okay, so just really quick, just as someone, just to be relatable for a minute, I remember when I first got Instagram, I was 12 years old, and that's when Instagram it was very casual, like the whole hashtag keep Instagram casual again. Excuse me. But I remember it started to change when I was about 15. And there started these things called influencers, and they had millions and millions of followers. And I'm sitting here and I'm like, how the heck do they look that good? Like all the time. And it's usually when I'm at my worst, like I'm laying in bed with no makeup on, about to fall asleep, and I'm looking at these people and I'm like, they're literally perfect. Like, how do I look like that? And I know tons of other people, at least when I talk to my friends, they tend to compare ourselves to the people we see on Instagram and the people we look up to. And as a creator, like my job is content creation. So I have to meet and look at these people, and I get inspiration from them. But what I tend to see myself doing is comparing. And I think that's a big problem in social media. And for young girls, it's like, first of all, you shouldn't compare yourself to anyone because you don't look like them. You have completely different circumstances. But also, as a 12-year-old, I was comparing myself to these 25-year-olds who have big girl jobs and who have their lives put together and things like that. I'm like, I can't compare myself because when they were 12, they were probably just like me. So I just think in social media, from what I've done as a 19-year-old to build my self-confidence, I had to unfollow all those people. You know, you can only search them up to see what they're doing, you know, if you want to be inspiration, but I only follow like family and friends, a couple people who inspire me. And if I want to keep following them, you can mute them so you don't see their posts every day or their stories every day. And it's just, as an older sister, I would just tell my younger sisters, because my younger sister, she's 14 and she's going through the same thing. She's like, Rachel, your life looks so perfect, you know, blah, blah, blah. And I'm like, you know what? Today I actually cried like the entire day. Like my life is not perfect. Like, you know, Maggie ran out of the gate today and work sucked and like blah, blah, blah. But I'm like, they would never know that because they see my life at its highest of moments. And that's like the whole thing with Instagram is that people only post their best moments. And that's why on TikTok, like Dr. Heather was saying, I absolutely love it because you see these people who are like, does this happen to anyone else? And it's like their life is completely falling apart. And it's funny because that's how everyone else's life is.
Yeah.
And that's how I want to be on TikTok is because, you know, most of the time I'm literally like, hey, I just woke up. I haven't even brushed my hair. You know, I'm not all put together. And this is how everyone else is in real life too. And people are just like, they love the genuine people in TikTok. And that's what they're going to go for because it's hard to constantly see someone's life who's constantly put together, you know.
I'm assuming Maggie, by the way, for everyone, was the dog that ran out the gate is probably.
Yes.
But, you know.
I totally agree. And Rachel, I have to say, it's not just unique to 12-year-olds, it's all ages, 20s, 30s, 40s. When people portray this very perfect, you know, life online where their house is always neat and everything, you know, there's always perfect, you know, blooming flowers in the background. And like, that is just not life.
Yeah.
That is not what real life is like. Life is very, very, very messy. And, you know, so that's not unique to being, you know, a little young girl. I think it's for all of us. We see people like, wow, she really looks put together.
But you know what?
So,
the one thing.
So I think that is key for young people to realize. And I think the grown-ups realize that's not real life. I think we do.
Yeah.
But definitely for young people to realize that and take Rachel's advice. Only follow positive accounts. If you don't feel good when you're looking at an account, don't follow it or mute it. You know, follow things that give you joy. I love to watch, you know, cats doing stupid things and like funny, ridiculous videos. And that makes me happy. And then, you know, when I go on social media, it's not depressing. I'm laughing the whole time. So you have to be very selective in what you follow.
Well, one of the things, though, that I really want to make so clear, and I think we can add some context to it, because both of you have touched on this, that people will be on social media that can lead to some of this depression, and their life looks so perfect, and they're so gorgeous, and they're so made up. Everything about them is perfect. They have no flaws. Okay, our world here, when we're not doing this podcast, which we only started because of the pandemic and we couldn't shoot commercials, we've shot supermodels, some of the top A-list actors and actresses in the world that we've worked with for years. You're familiar with our Dr. Heather. And I have to tell you that, and this is not any disrespect to anyone, but they don't look like that. They look like that after 5 hours, in many cases, of hair, makeup, wardrobe, and a team of people, and a very talented crew of lighting experts and specialists. And everything is planned and prepped by a team of 20, 30 people weeks and weeks in advance. And I'm not in any way condemning what we do for a living, what we've done for a living in commercials, in the beauty world, in the skincare world, which is how you and I met and started working together many years ago in skincare. At all. I think, you know, it's, I feel very good about what we do, but I would not feel very good not being very direct with people, and I always am, especially if someone says to me, oh, I saw that commercial with so-and-so, and they happen to know that we've done it. You know, my God, she's so spectacular, whatever, she doesn't even have a flaw. And it's, you know, it's a hard thing because I don't want to say, oh, yes, she does, like in a negative way, but it's like, of course she does. Who doesn't? Everyone does. And it's not a negative on that person. It's, you have to realize that nobody looks like that. Not when they're 50, not when they're 40, not when they're 30. You know, I have twin 4-year-old girls, and they do not have skin that is as perfect as some of the 40, 50, and 60-year-olds you were seeing in these campaigns. And, you know, my 4-year-olds are pretty darn cute and perfect. But I'm just, it's really, really, it doesn't exist. people, if you're watching this,
Right.
you are watching an illusion. You are watching a fantasy. It is created in a way that it is heartbreaking that it does have such a negative impact. I think the advice that you guys are giving is spectacular. You know, and something that we've learned over the years, it's interesting, but even on our own social feeds, we really don't promote work with celebrities or people unless we have like a genuine relationship with them on a personal level where we know them and feel very good about them and just feel that, you know, it's not something, or they're not the type of people that are going to lead to someone, you know, feeling badly and judging themselves.
Right.
You know, you've been in the business since you were a kid. I mean, so.
I have.
Yeah, I think that also the other thing is that my favorite posts are those posts like before Photoshop and after Photoshop. Whenever I run across those posts in my feed, usually that's an Instagram type post. But those are the ones that are really eye-opening for people because, you know, it's, one of the probably, as I mentioned earlier, one of the most common things my patients say is this normal? Have you seen skin like this? Have you seen acne like this? Have you seen hair? Like because everyone thinks that photoshopped picture is what people's skin looks like, and nobody's skin looks like that.
People are starting to look strange almost.
Right.
Like we were watching the Super Bowl
Yeah.
commercial, Mila Kunis, we were looking at her face and I'm like, what? She doesn't look human. There's something odd about the look of her face because it was so retouched.
Oh, someone brought the hater to the podcast today.
No one's skin. I see skin
Talking real.
up every single day. Nobody's skin looks like
And
that.
not
People
for
have
nothing,
little black heads, white heads. They have, you know.
Or when someone's being paid $8 million $8 million to say, I used this acne product to lose this one pimple. I mean, you know, I look at it and I'm like, hey man, I'm in the business. Come on, that is just the stupidest thing in the world. But let's talk about acne actually, because I know comes up a lot with Rachel and your folks. You're a dermatologist and deal with it.
And you have some experience.
I had severe, horrible acne that no one here even knew about till we were doing this thing I talked about yesterday. And well, since you brought up mine, I think that you have had some acne you've shared before and brought up stories and stuff. So I'm not being, you know.
No, I had UTIs. Rachel, thank you for talking about that on your podcast. Side note, it's embarrassing as a young girl. It's embarrassing as an adult when you work for a man. How do you say, like, I can't come in today, I'm in so much pain? It's awkward. It's uncomfortable. Thank you for bringing it up. And back to your acne.
But if we can clarify, no one in our agency has to call me and say if they have a UTI. That's not the policy here, just in case. I mean, she's using a little bit of...
but I enjoy it.
Right, yes. We have a nice lady who's in HR, and anyone can speak to them and doesn't have to say if they're sick. So she did that on purpose to throw me. Anyway, we do have a lot of women here. When you work in beauty and skincare, and for the most part, you have 20-something women who work with you, you learn to behave, I guess is what I would say. When
real quick,
smarter people.
Before we dive into the list of questions we have for you ladies, I have a question for all of us here. What's the one piece of advice you were given that you did not take and you now regret? Mine is wear sunblock. I had a little spot of melanoma taken off right here at age 26, and all of my sun damage is now coming out. Wear sunblock, people.
I mean, I just learned to wear sunscreen because I follow Skincare by Hiram on TikTok, which is great that there's the platform out there. But I don't know. Me probably would watch my diet. My metabolism has slowed down. I know I'm 20 and, you know, all of you guys probably hate me for saying that, but it has slowed down a couple. So, you know, probably just watch my diet, and I wish I did more and I probably learned more about it. So that would probably be my one thing that I wish I learned.
Dr. Heather?
But
Yeah, I would say for me, Rachel, I'm with you on that one because I love to eat, and wait till you're 48. But but the other thing I would say is, value your sleep. Sleep. I always call sleep the underdog of health and wellness, and I really make a huge effort as an adult to like try and have really good quality and quantity sleep. But don't take sleep for granted. I guess that's would be a piece of advice. I would say sleep is really important. So make sure you get good quality and quantity sleep. Don't skimp on your sleep.
Yeah. You know, if I could say anything, and I don't mean this like from a, hardcore yes or no thing, but I would really encourage people, especially younger people, to be much more aware of alcohol and recreational drugs, especially when you're younger, and it's just might seem it's what everyone is doing. It certainly was when I was a kid. I mean, I don't recall a time growing up from the age of 13 or 14 where some type of social gathering happened where it wasn't really 50 people around a keg in New Jersey on the beach. That's just what it was. So I would really encourage people to just say that's does not have to be your social outlet.
To add on that too, Drew, I mean, I'm going to be 35 this year, and I have many friends who decided to try drugs younger. Some are no longer with us. Some have had problems. Some kicked it. But to be honest, when you're 18, you're not thinking of your future self, and the people who made those choices, they're not okay right now. Even like sometimes they're just like mentally altered a little bit, or they can't catch up with the rest of people. It is not worth it.
Yeah,
and just
go ahead, Rachel.
Sorry. Okay. Yeah, and just as someone who's gone through high school, and I'm just talking to my audience a little bit here, and a lot of girls ask me, like, what is your tips for high school, things like that. Your friends are going to change, and they're going to do things that you don't agree with. And I think something that's just very like stereotype people think of, but peer pressure is very real. And I struggled with it. And, I think of myself as someone who has like a little bit higher standards or whatever, not to put myself on a pedestal or anything, but a lot of my friends started doing things that I didn't agree with, and I felt this peer pressure that I'm like, oh, if I don't do that, I'm not gonna be cool. People aren't gonna like me. But you know what? I thank myself now because I'm 19 and I don't have an alcohol like issue. A lot of my friends do, and it makes me so sad. And just besides like the weight gain that they have, they can't go a night without it. Mm-hmm. And it's screwed up their schooling. They can't think straight. They can't go without it. Or the nicotine addiction that's becoming very real now with the whole Juuls and everything like that.
The vaping, yeah.
Mm-hmm. I think myself, it's like in the moment, yes, it's really hard. High school kind of sucks. Everyone knows that. But now it's like I don't even talk to those people anymore. So I'm glad I didn't give into peer pressure because their opinions don't matter in my life now. And I'm able to function and I don't have those. So just to the girls out there who are maybe listening to this, or even the adults, you don't have to cave to the peer pressure because I'm sure there's peer pressure in the workplace and things like that. And it's just like, think of your future self. And I actually did a post about this, and it's like, work for your future self. And it's like, do things today that your future self will thank you for. And that's kind of like my life motto and something that I wish I knew as a kid going through middle school and high school. Because it's like, this is really when it comes down to it, the only opinion that matters is yourself and what you think of yourself. And it's like, okay, if I cave to that, am I going to really love myself for doing that or whatever? And I don't think there's any harm in like drinking here and there, honestly. But I just think try to prioritize yourself. And if you see yourself having an alcohol addiction, there's help out there. There's medical help. There's things like that. But that's just something I wish I knew going through high school and
Rachel,
stuff.
tell everyone, and then we'll have Dr. Heather, and we're going to jump into the questions as well, but because it's live and we're not putting things up on screen as we normally would when it's live, what is your TikTok handle exactly? Because there's a lot of people watching right now. I want to make sure that everyone's clear on how to find you who isn't already.
Yeah, so it's at That Big Sister Advice. That's my Instagram handle as well.
At That Big Sister Advice is where people will find you.
Yes.
And Dr. Heather, what's the best way for people to start following you? Because by now people are probably like, I want more from them.
At Dr. Heather MD, and that's on Instagram, TikTok, and YouTube. So Dr. Heather, Dr. Heather MD.
Got it. All right. And we're going to start going into the questions specifically. One of the ones, and Dana kind of brought it up as well, and it really surprised people here, which makes it more interesting, is a lot of people wrote in about Accutane. They had questions about that for you. When I told everyone, and we were preparing for the show last night, oh yeah, I did 2 rounds of it, when I was younger, and people were really surprised. And I did, and that was a lot of years ago. I don't even know that they would suggest today 2 rounds, but I mean, it took its toll on some stuff and helped with my acne. But I have some regrets about that, potentially about some of the side effects then and maybe long term. What do you think, Dr. Heather? I know that people ask a lot about that, especially of Rachel.
So Accutane, I mean, dermatologists, we use Accutane for the right cases. So severe cystic acne. Why would you choose Accutane? Because when you have severe cystic acne, you have a risk of scarring and the scars are permanent. So for most people, Accutane is not risk-free. We check it's usually a 5 to 6 month course. After 5 to 6 months, 80% of people are cured. That means they don't need any more Accutane again, but 20% of people, the acne can come back, and Drew, you fell into that category, and that might need a second, and some people even need a third course. But for most of my patients who have been on Accutane, it's liberating because people who have severe cystic acne, they've been studied, severe cystic acne has a greater impact on quality of life than things like diabetes or things, because when you have severe cystic acne, it's very difficult because people ask, oh, well, first of all, strangers will volunteer, try this, try that, try apple cider vinegar, try all of these things. So, and I'm sure they're coming from a place of, warmth and wanting to help, but it makes the person feel very, very, very self-conscious. So to answer your question about Accutane, it's the right medication for the right patient. And the reason why we use it is to avoid scarring. So people who have severe cystic acne are at risk for permanent scarring. And so Accutane, it takes around 5 to 6 months, actually usually 6 months, but at the end, 80% of people are cured. So it does have risks. I'm not saying it's risk-free, but it's something that is a good choice for the right candidate.
What do you hear, Rachel, when people are reaching out to you? And I don't know if you've ever dealt with acne, but what is your experience and what are you hearing from all of your followers?
So I actually did deal with really, really bad cystic acne, and I actually almost went on Accutane. But then we found out it was actually an allergy to dairy, and it was showing up, your digestive health can show up on your face sometimes. I don't know if that's accurate, Dr. Heather.
Dairy definitely makes acne worse.
Okay, good. Okay. Yes. I just don't want to say anything wrong. But I actually have an allergy to just milk, not just dairy, but it's literally just milk. So I just switched over to almond milk and a lot of my acne went away. You can't really see, obviously I have makeup on, but I have pretty deep scars on my face. And I know the whole quality of life, yes, like I would be going to classes in college and random people would be like, oh, hey, and they would just point it out. And I'd be like, I was having a great day. Like, why did you have to point that out? Or like my grandma would say something every time she saw me and was like, hey, have you tried this? And I'm like, yes, I've tried everything, So it just makes me sad because I know how insecure it can make you. And for me, it is liberating when your acne goes away. And I would suggest Accutane. I have a lot of friends who go on it. I didn't go on it, luckily, because mine was just an allergy. So something first and foremost I would hope people would do is go get their allergies checked, just because I do know that Accutane is really hard on you, especially as a woman, because you have to go on birth control. And I'm anemic, and that was an issue as well, because I know your iron levels play a big part in Accutane. And so that would just be something I would say before you go, just try to get all your options, things
and
like
I would say, go to a board certified dermatologist who can address, all of these issues. The main side effects with Accutane are we check your liver enzymes. So typically we don't see that problem in young people, but with, it's always always a possibility that, it can affect your liver. And then also we check your cholesterol and your triglycerides because it can make those lab values go up. And then, it causes dry eye and dry mouth and sometimes headaches and muscle aches. And then also in the consent, and there's an extensive informed consent for Accutane. So women have to be on 2 forms of birth control, and at every single visit have to confirm in the computer that they're on 2 forms of birth control. And because there's a risk of birth defects. So it's not a simple, easy thing that you just, jump into and don't think about, but it is very, very liberating when people who are the right candidate and, really are informed about the decision, get the treatment because, in 80% of cases, the acne is cleared.
Yeah. And the key things that you're saying, especially because it's a younger audience watching, especially for Rachel, is, and doctor, you'll correct me if I'm wrong in any way, is that younger people who have acne, number one, may or may not be as inclined to follow every critical protocol the doctor's laying out. So young women, if you were to get pregnant while you're on Accutane, there is a higher chance of birth defects. Is that correct? Is that what the risk is?
That is correct. So you have to be on 2 forms of birth control throughout the entire course. So, and that's really serious. And, the physician checks, the pharmacist checks, everyone is checking to make sure of that.
And if you're also a young man or a young woman and you're under 21 and you're choosing to drink, as let's be realistic, millions and millions of people under 21 do, that was, my stupidity in that, I was a young college freshman going through Accutane and then doing keg stands at night, being a complete moron. So you can check any box that you want, but ultimately the responsibility is on you. So hopefully young people who are hearing this, and if you're asking about Accutane, and don't stop after you hear Dr. Heather saying, yes, it can make it go away and it can prevent scarring. You cannot drink alcohol when you're on this. You can do some serious damage to your liver. That's
a great point. That's a really, really good point. And when I do see young patients who are interested in Accutane and want Accutane, we really do discuss that. And a lot of my college students, thank God, will ask, can I drink? And I say absolutely not, because the one thing that it can affect is the liver. Like, we check all of these other things, but the liver, cholesterol, and triglycerides are the things that we're most concerned about.
And there's some other side effects. I mean, you can get, again, it's a risk-reward payoff. I used to get bloody noses from it, and, yes. Sometimes that will happen from excessive dryness.
Because it dries everything up. It dries up like your nasal mucosa.
Yeah. But on the flip side, Dan and several of the people here yesterday, you had acne? So again, I had severe acne to the point where I was skipping certain classes in college, taking an F. I didn't want to do public speaking because I was personally so awkward and embarrassed that I had such bad acne as a freshman, and it did make it go away. So it's common sense, but if it was common, everybody would have it. So hopefully people are listening to the expert that there's only a way to use it or not, and listening.
I have a quick question just before these questions, and then we have to dive in.
Okay, we will.
For so many of Americans that do not have health insurance, I mean, Accutane's expensive. Prescriptions are expensive. What do you recommend they do with their skin if they don't have insurance and they don't have access to a doctor?
That's a great question. So a simple over-the-counter regimen for acne. So the good news is, the main thing we use, Accutane is a retinoid, and a retinoid is a class of drugs that works on acne. Accutane is a retinoid that you take by mouth, but you can also use retinoids topically on the skin. So the good news is, a few years ago, Differin Gel went over the counter, and that's a retinoid that really can be helpful. And that's something that you use typically at night. So Differin Gel is over the counter. And then in the morning, you could use salicylic acid or benzoyl peroxide or a combination of both. I think benzoyl peroxide is a really effective treatment, but a small percentage of people are allergic to it. So if you can tolerate benzoyl peroxide, that is definitely one of my favorites for cystic acne, either a medicated wash, a topical gel, or again, a combination of both. Although that can be a little bit drying. And then if you happen to be in the group that's allergic to benzoyl peroxide, then I would say salicylic acid. So those are the 3 things that you can do over the counter, and nothing is going to approach the efficacy, if you have severe cystic acne, of taking something by mouth. But there are options over the counter, and Differin used to be by prescription up until around a few years ago.
Let's jump into some of these specific ones. We'll go back and forth.
So these were sent in to Rachel's TikTok, which is exciting. And then we have a couple on YouTube when you're done, Drew.
Very good stuff. Okay. How do you get rid of stretch marks? Dr. Heather, why don't we start with you on that?
Stretch marks are tough. I'm chasing the sun here. I have to find where I'm like, this is Florida. This is Miami. The sun is always.
And you're not supposed to have sun on your face as a dermatologist and skin expert.
I know. I just happened to sit in front of the window, so I might have to close the curtains in a minute. But so what can we do for stretch marks? Stretch marks are tough. I'm always very honest and straightforward. There's no miracle cream, no treatment, nothing that I can say, oh my gosh, put this cream on, and in 4 months your stretch marks are gone. No, I cannot say that. But in clinical studies, using, again, that class of drugs called a retinoid, remember I just talked about that, so something like different, and clinical studies can make the red stretch marks, so the early stretch marks, fade to the lighter stretch marks, or the white stretch marks, more quickly. But nothing, I don't want anyone to ever feel that there is a cream that removes stretch marks. Stretch marks are, in a way, a type of scar. So, because basically the skin has been stretched so quickly that it basically left these lines. So you can try something like a retinoid, like Differin. There are some procedures like microdermabrasion or microneedling that have been used for stretch marks, but I also want to set realistic expectations and not have anyone think that there's this miracle cure for stretch marks that gets rid of all stretch marks, because that, unfortunately, is not the case.
So it's a phony. If you see it, don't buy it. If you see someone selling
so if there was a cure, I would have no stretch marks right now.
do you hear that? You don't hear that from your audience as young as they are, or do you hear a lot of that, Rachel? Are people asking that? Someone wrote it in, so.
So basically, what's nice about the community I built is there's a bunch of other girls who will reach out and answer questions before I even get the chance. And so a lot of them were talking about like, hey, stretch marks are normal. Like everyone has them. You know, you look at Kylie Jenner, she even has them from having her kid and being pregnant. Like it's unrealistic to not have them. I mean, if you don't, you're lucky, because I even have them. And it's like, a lot of girls will just be like, yeah, you know, there's bio oil, which I don't know if you've heard of that. They say that works. They say different, like a retinoid works. A lot of them say they want to know how you can prevent them. The only thing that I know is like moisturizing a lot, things like that. They were asking about, is shea butter a good moisturizer for that? Things like that is just part of that.
I'll say there haven't been great studies. There's not like this huge body of evidence on stretch marks. So I would say two things. And Drew, to answer your question, it's very common for teenagers to get stretch marks because they grow quickly. And then women will typically get stretch marks on their thighs or the sides of their buttocks. But boys can get stretch marks too on their arms, on their legs also, because they're just growing so quickly, basically, and the skin can't keep up. And so I would say, how can you prevent them? Well, obviously, when you're growing, it's good to be growing, so you that's fine, right? When women get older, you can sometimes get stretch marks from pregnancy, and some people do use lots of moisturizers to try and prevent them, but I don't know if there's a ton of clinical data on there. It certainly won't hurt. So I always am open to things that won't hurt. So using cocoa butter, shea butter, or any of those things, to try and prevent stretch marks certainly won't hurt, but I don't know if there's a tremendous amount of convincing data to say it will help.
What were you going to ask, Nan? You want to ask the next one?
I was going to say that kind of answered half of the next question that was submitted. Is shea butter a good moisturizer?
Shea butter is a great moisturizer, especially like I've used shea butter on my legs in the past. You have to be careful on the face because things like, I know for sure cocoa butter is comedogenic, and comedogenic means that it can promote pimples. So you can get increased pimples using cocoa butter on the face. So you have to be careful with those heavy butters on the face because they can cause pimples, but on the body, I think they can be great.
We have a question specifically from, and we've chosen, if some of the questions were too personal, we aren't saying someone's name, obviously, but people put their names with them. So some of the basic ones. That one we did. What skincare product from @Rory De Palma? What skincare product is the best for red spots and acne? So they're asking really for a specific recommendation, if you have one or if you have a couple of that you've seen out there, or types of ingredients. I know you mentioned benzoyl peroxide, but maybe you can expand because there are a lot of questions asking for some specifics.
So for red spots, really, a red spot from acne is that after the acne heals, there's some leftover inflammation. So basically, there's just redness in the skin. And actually, redness is probably one of the hardest things to treat because the good news is that it fades on its own. So that's a good news. So if we did nothing at all, it generally gets better. But the question is, how can we speed this up? There's some products on the market, like redness relief products that have anti-inflammatory ingredients that help to kind of decrease inflammation in the skin, and they may help. The other thing that I like green tea products. So there's a product by a brand called Replenix that has green tea in it, and that seems to calm the skin and reduce redness. So I've definitely seen some improvement with that, but again, I love to set realistic expectations because I don't want people to think you put this cream on one night and the next day the redness is completely gone. No, I wouldn't say that, but there are different treatments that I think can help to calm the skin and soothe the skin. And the best treatment for red marks is to prevent the acne in the first place. So really have a really good acne regimen so you don't have inflammatory acne.
Rachel, is that helpful for your viewers and people who have been asking you? Because we got lit up on all those questions about that.
Yeah, so I even just have my own personal question because I've struggled with acne. So a lot of people, when they ask for my skincare, I made a skincare video and I use a lot of the CeraVe products. I use the CeraVe retinol at nighttime, and I have very combination skin. I mean, I'm from Texas and now I live in Arizona, so my face is dry but also oily. What do you think of the CeraVe product line? A lot of people suggest it, but I just want to know what your own personal opinion as a doctor.
I love it. I actually recommend it all the time. CeraVe is great for sensitive skin. It's great for people who have, because remember, as a dermatologist, a lot of people I see come to me with a problem. And it sounds like you might have slightly allergic skin. I know that you were allergic to dairy. So people who come with a problem. So we use it a lot for kids who have eczema, and I'm sure a lot of your followers have itchy, dry skin, especially those in dry climates like Arizona or the Northeast. Or California, everywhere but Florida. No, I'm just kidding. Lots of eczema in Florida too. But definitely we see this issue with dry, sensitive skin, and CeraVe has, why is it so helpful? It has ceramides. So ceramides are one of the natural lipids that we have in our skin. We have 3 lipids in our skin, which are cholesterol, fatty acids, and ceramides. And ceramides form the barrier. So we call that barrier repair when you use a product that has ceramides. So I absolutely recommend CeraVe every single day. And I love it because it's very reliable in people with sensitive skin, because I know pretty much you're not going to have any issues.
And people don't have to spend a fortune. Yeah. That's one of the other questions that a lot of people wrote in. How much do I need to spend?
In affordable skincare. Yeah. Big believer in you don't have to spend, hundreds and hundreds of dollars to get really effective products.
We have CeraVe. We have CeraVe in my house, which I think came from you, actually. That's probably what, is that what Jackson's?
Yeah.
I don't even know. I mean, Dan would know this, but the people here know, but one of my kids has perhaps the most severe allergies ever on record, actually. I mean, his story. And I was shooting with Dr. Heather several years ago on a campaign, and literally brought Jackson to set to show him to her. And this poor woman was about to go on and shoot a big commercial. I'm holding up a 2-year-old saying, what would you, and thank God she was helpful in there and gave some of the very best advice about his eczema, his situation, his allergies. And as you're saying that, I'm like, I don't recall a time where I've turned left or right in my home and not seen a 5-gallon of CeraVe, if they make it in that. And I'm like, of course, it came from you, and was so. Yeah,
it's a great product, especially for people with sensitive skin, and also, as you mentioned, Dana, on a budget. It's really a great all around, win-win for everyone. And they have products for acne now. They have that brand really exploded, I would say, and a lot of it really got popular on TikTok. And we're here because of TikTok. And dermatologists have known about CeraVe for 15 years or more. But then I think TikTok really kind of took it to the next level as far as awareness of a really good product that's not expensive, affordable, and it works.
Why are we not doing the commercials for them? We're sitting here promoting the heck out of this thing, and of all these products that we did, skincare.
I'll call them.
Please.
I like that it's for sensitive skin, because I just became sensitive. Only my skin.
Right. I was about to say, there's 25 people here who do not agree with that
No, I
statement.
turned 34 and suddenly everything irritates me. So I'm in the market for all sensitive skin products.
Right. As you age, your skin gets more dry. That's the problem. So
And she gets more hostile, but that's
why your skin.
This is true.
When you think about a teenager, with really oily skin and and then as we age, it decreases and decreases and decreases, and all of a sudden there's a switch.
So I should be moisturizing daily.
I will say that
yes, definitely.
our
Definitely.
podcast has come a long way since we launched it in March, because if we go way back, and maybe we'll show it when we do a re-record of this, there were episodes where things would come flying in at me before we even built the set, and if she didn't like what I was saying with a guest or a comment, she would throw stuff.
Was it deserved?
I'll leave that up to America to decide, but literally you'd see like a piece of paper come flying across my face. It was
we have fun.
That's why we put her on set, because she couldn't throw stuff at me. We figured if she's actually on, don't do it. Rachel, I know we only have a few minutes left, and I want to just really hit on a couple of other things you mentioned. Are there things that people ask you that you just say, I don't want to answer that. I'm not comfortable answering that, or none of your business? Is there a policy that you have on your channel of I'm not a total open book about everything or anything?
Yeah, so there's about one main subject that I think is very personal, and I think a lot of other people can agree on. And a lot of girls are asking, like, oh, a story on your first time of losing your virginity. And me, my own personal experience, I waited till marriage, and that's just my own standards or whatever. And that's something that, I would tell my own sister, but I just don't want that to be out in the world. You can get a lot of hate, people can twist your words, whatever. And that's something, but it's like, if people are like, oh, does it hurt? And I'm like, you know what? That's something that's different for everyone. For me, maybe it was painful, but whatever. Like, it doesn't matter really, but that's like something that's super confidential to me. And I don't feel like sharing that whole story, the experience. And there are other sources out there, people who are comfortable with sharing that and things like that. But just for me and my husband, I think that's like, kind of sacred to me. And I don't feel like sharing that. And I feel like other people can respect that just because it is so, vulnerable and things like that. But and that's where I tell them, I'm like, you can go talk to your gynecologist about these things and actual medical doctors who can explain. But yeah, that's probably the only thing that I'm not an open book about. But everything else, I'm pretty wide open like that.
I remember when I found out about your TikTok, is someone sent me a video, and it was this, young lady, yourself, you're 19, right? And and you're in your bedroom. I know now. I asked you that's what's so great about TikTok, and you're obviously in your home where it's not a big, glorious built-out set and lighting and all this stuff. It's so real and authentic. And you start to talk, and you start talking. Dane touched on it earlier about how to avoid a UTI when after having sex, and you're just so open and real, and you weren't sensationalizing, but you weren't underplaying. So I think that is when we talk about how someone decided 10 days ago to just, I'll do this TikTok thing and put a name up, my big sister advice, and all of a sudden you're approaching 250,000 followers without spending a nickel. And I know skincare companies have been reaching out to you and other sponsorships, and your head's starting to spin. And I know you said you're just going to keep doing what you're doing authentically. I think the fact that you really, don't have a TMI policy and you want to be there for everyone, other than saying, hey, this isn't going to help you, my own experience, I'm keeping that for me and my husband privately, with all due respect. I think that's a wonderful thing. I mean, I guess I'm giving a bit of an editorial on that, but I obviously was drawn to you and what you're doing, which is why I reached out to my friend, Dr. Heather, who I've known for years, and said, there's a very special young lady, and I sent her your info, and I said, we want to chat with her. I think you would be a great medical expert. So I'm really glad that we were able to pull everyone together. And I know we have time for a couple of more questions, and then we'll kind of go into a wrap up of this. The good news about social media and TikTok and everything is now people can go directly to Dr. Heather and Rachel and have unlimited access and resources to them through TikTok, Insta, and social. What are a couple of more of the questions? I know that you had a couple you want to hit, and maybe Dr. Heather has one, and maybe Rachel wants to say something as we...
Let me read a couple that just came in on YouTube Live. Liliana, Dr. Heather, what age should you start seeing a dermatologist?
So that's a great question. If you're young, so there's that's such a it's a I'll try to answer it briefly, but it's kind of a complicated question. So some people have lots of moles, right? Just hereditarily have a lot of moles all over their body. Those should be monitored by a dermatologist regularly. So, really, there are some kids that we'll see from early childhood that we check their moles every year to make sure they're not changing. So there's definitely a group of people who start really young and see dermatologists all the time because they have a lot of moles. But the most common time that people start to come to see a derm is when they are teenagers and they start to get acne. So I'd say most people, not everyone, because Dana, you mentioned that that was not a part of your world, right? Seeing a dermatologist as a teenager. But definitely teenagers will come and start for their acne. And I see we didn't talk about this, but a lot of adult women with acne. People think of acne as a disease of teenagers, but most of my acne patients are adult women. And I also want to normalize that. That is completely normal for all of our adult women out there struggling with acne. So it really depends. If you have a lot of moles, it doesn't matter what age you are. You have to see a dermatologist yearly, and everyone should see a dermatologist at some point for a skin check, to kind of gauge what your risk factors are. But the vast majority of people start when they're teenagers.
Thank you.
In my practice.
And I know we have some, I love that people have been stacking up there. We'll go into some of them. There was another thing you or Adrian or some of the ladies, and I referenced it before. I hope it came across, but we're very fortunate that the majority of our company and team is women here. I think that if we did anything smart, we're smart enough to hire a lot of very smart, talented women. There was a topic that every woman here almost reacted to that I think Rachel had touched on about having three.
The only one I see here is, I won't read the name, How to Correctly Take Care of Your Own. Not that one?
It was, I have 3 holes.
Oh, right. Rachel, you said that to us when we first initially
I was hoping not to be the one to introduce that topic, but all 3 of you just left me hanging.
Okay. You're one of the girls today.
Yes. So that's something. I'm 17 years old. I'm sitting here and I'm like watching this movie and they made a joke about that. And I was like, what? I'm sitting here and I'm like, you mean I don't pee out of my vagina? And people are like, and I'm just like, this is something that no one knows. I'm telling my friends, I'm like, did you know we have 3 holes? And they're like, what? And I look over and I'm like, at the time I was dating my husband, but I was like, did you know that women have 3 holes? And he's like, no, I had no idea. Like, even like most women just don't even know for a long time, let alone the men. Like, I'm telling my brothers and they're like 17 and 22 and they're like, what? Like, you have 3, like, it blew my mind out of the water. And I'm actually planning on making a video, just a super short video being like, did you know that if you're born a female, you have 3 holes? Like, I had no idea. And I'm like, you would think I would know a lot about my body, putting in tampons, things like that. And like, it was just so funny. And this guy on TikTok was like, wait, how do you pee when you have a vagina or when you have a tampon in? And I'm like, that's a good question. I'm like, you don't think about it. So it was just interesting that as like 17, you're like, oh, I know everything about my body. You've gone through puberty and that's something you just don't know.
But if someone doesn't teach you, I mean, think of it like this, as basic as it is. And again, you can't get any more basic than, little people. I have what you would call like Irish triplets, a 5-year-old boy and twin 4-year-old girls who are like 10 months behind him. And they're just starting to get out of that phase of being naked all the time. Like, I mean, and sometimes they just decide to have a naked day or a naked party and they're at that age. And my twins, well, they absolutely will say, I have a penis. We have a penis. And we'll say, no, Jackson does. But, and who's ever around them will say what they do have and whatever words, that we use that are the cute anatomical words for them. And a lot of times, they'll use the real anatomical words as well. And they'll start to cry. And because for them, they're 4. They take baths with their brother. They do everything. They jump up and down on the trampoline naked and stuff. To them, it's just one more toy that he has that they don't because they're 4. But yet in life, they will be taught those things. Parents are comfortable at that age saying, no, you have this. Jackson has that. That's the way, God made you, whatever your belief is, that's what we'll say to them. And yet something happens where an age happens where it just shuts off, where the kids don't want to talk to us. i.e. my daughter at 13, or the parents get squeamish, and I can totally appreciate that and everything else, and they're not comfortable talking to the kids. But it is something where we obviously get it when they're little, that it's nothing to be ashamed about, and it's not awkward. And yeah, it's funny for 2 seconds, but not embarrassingly funny. We don't shame them. We say, no, sweetheart, you have this is your anatomy, and this is Jackson's and whatever, and it's not a special toy that he got a gift that you didn't. And so it makes sense then all of a sudden that at some point we just stop having those simple conversations, and thankfully you're having them. I think that's such a wonderful thing that you're doing. And a couple more, and then
Erin Murphy, what age should you see a gynecologist?
Ooh, that's a great question.
Well, again, it's not such a straightforward answer, but obviously any person who is sexually active should be seeing a gynecologist. That's absolutely, across, and we're talking about women, obviously. And so that is the first piece of advice I would say. But it really is personal. I do think that no matter what, by age 18, you should have an exam. But most people do it earlier. I mean, it's not uncommon to do that earlier, to have your first exam earlier than 18. But no matter what, across the board, if you're sexually active, or you're considering being sexually active, or you're thinking about being sexually active, you should absolutely see a gynecologist.
And hopefully talk to your parents. I'm not trying to make a PSA.
But some people live in households where that might not be an option.
Or I just didn't want to.
And you can talk to your pediatrician. Luckily, most great pediatricians will have some quiet time alone with their patients without the parents in the room, so that the child or teenager feels comfortable talking about issues that they may not feel comfortable talking about with their parents. So if you're worried about that, ask your pediatrician, and the pediatrician can also be really helpful.
And I just said, hopefully talk to your parents or parent, and I got the...
Nope, kids don't do that.
Well, some of them do, and it was a reasonable thing. As a parent of 4 and 3 girls, I think it's a fair, reasonable thing, and I'm sure there's a lot of people out there nodding and agreeing with me, as many are shaking their head.
I'm going to text your daughter, make sure she talks to you.
She won't talk to you.
Right. I remember the first time I went...
Just send her my way.
Thank you, we will. The first time I went to a gynecologist, my mom brought me to hers, who happened to be a male who delivered me. And as a young girl, I'm like, you don't want to ask questions. And that's why I passed the notes in high school, to see where all of the other girls were going. And then I wound up going to a Planned Parenthood to meet girls and ask them questions. So make sure whoever you go to, you're comfortable asking questions.
I totally agree with you. When I was younger, my gynecologist I would always choose women, usually in student health or wherever, but it's sometimes that's not to say that there aren't male gynecologists who are great with teenagers, or young people, but I definitely think it's completely normal if you're young that you might prefer a woman.
Yeah, I think I don't really care if people skewer me for it, whatever. It's not whatever. I think it's very weird and unusual in general that I would not want my daughters going to a male gynecologist. I'm sorry.
It's just my mom trusted him. It was her doctor.
One of my nieces was, and I was like, wait, and I was talking to her mom, like, don't, just maybe I'm naive. I don't know, but I would simply prefer.
I think everybody's different. I will tell you, everybody's different, and male gynecologists have great bedside manners, and we can't generalize that everyone is a certain way.
I'm not accusing them of anything.
But I also think, the most important thing for me is that the patient feels comfortable. Yeah. As long as the patient feels comfortable, then that, because and this is across the board with every doctor. Make sure you feel comfortable with your doctor, whether it's your pediatrician, your primary care doctor, your dermatologist. Make sure that you always are in a comfortable setting and you never feel, intimidated or you don't feel comfortable asking questions, because that's what we're here for. My patients will always tell me, I'm so sorry for asking all these questions. I said, don't worry, that's why you're here, So make sure you feel comfortable.
And tell someone if any, go ahead, Rachel, you're the...
Yeah. For me, my mom has a male gynecologist, and that's just what she's comfortable with. When she's delivering her babies, she prefers a male over a female. That's her own personal thing. And when, so I have an IUD, that's my preferred form of birth control, what works for me. And when I signed up to get one, I saw it was a male doctor, and I just preferred, my first IUD being inserted inside me. I'd rather have a female. And that's not to say you're not going to be nervous to ask her or him, whoever you prefer. In general, it's just saying, you know what, think about it. I'm like, okay, would I be more nervous to ask a male doctor this rather than a female? So that's not to say you're not going to be nervous and you're going to be completely comfortable the first time you're asking these questions. That's just what I prefer was a female, putting my IUD in and things like that.
Real quick, did the IUD hurt?
Okay, so I don't handle pain very well. I actually passed out when I had mine put in.
Oh.
That would qualify as a yes, perhaps?
That's an important question.
Usually when someone passes out,
Yeah.
I'm not a doctor, but can I say medically speaking, that
That's
means
it.
yes,
I'll have
it
a
hurt,
baby.
right?
I know. But I'm severely anemic and I was on my period. They usually prefer when you're on your period to put them in because your cervix is widened. But when they put it in, you start bleeding a lot. And so I started losing blood, which made me a little bit nauseous. And then I just stood up too quickly and it was super painful. I've been known to pass out. I passed out on my wedding day, whatever. It's like my thing. So it did hurt a little bit. You'll have cramps the next 2 to 3 days and then light spotting for the next 6 months. I mean, I only had spotting for the next, I think it was like 2 to 3 weeks. But yeah, so it does hurt. My sister-in-law had hers put in. She said she didn't even feel it. It's just, it depends. I would tell you it hurts just so you don't get your hopes up that it's not going to. But yeah.
I'd be remiss, but can we ask why you passed out on your wedding day? I mean, it's not too personal.
Yeah. I didn't. So, I mean, I'm hypoglycemic, so I have blood sugar issues. So I have to eat constantly. And I was so nervous that I didn't eat at all. It was 80 degrees. I was wearing a long sleeve dress. It was a whole thing, so I just got lightheaded and my sister caught me, luckily.
It was before or after the vows? Yeah, you got up and finished and did the...
No, so we were taking pictures by then, so it was after, luckily, but it's in the wedding video.
Wow.
So it's funny. We laugh about it now.
Put that on TikTok.
Yes.
Now that would be cool. I'm not trying to tell you what to, just sharing some marketing tips there, since I've not been able to share a lot of advice on this specific episode, and even when I've said...
Thank you.
Okay. Last question from our list here, and then we'll let our wonderful guests have the last word.
Okay.
I'm trying to live ones because I know I'm getting texts saying that there's a million people sending questions.
Okay. One more. What is the over-the-counter retinoids that Dr. Heather recommended?
It's called Differin, or it's DIF. I think I can't remember if it's one F or two S. ERIN, Differin gel.
Find one more. That was a repeat of better.
Sure. Okay.
Something that's
That's it from there.
Yeah. Because we're asking a lot of the similar ones on that, but no, it could be any of the live ones if someone has.
That was it from
okay.
that Adrian's sending them to me. Yeah.
Oh, she's forwarding them. Okay.
Oh, how do I know if a mole is cancerous?
You see a board certified dermatologist. So that's really, really, really important. But there's some basic things you can look at from home, and we call those the ABCs. So is it asymmetric? Instead of being a perfect circle, does it have, is it like if you cut it in half, does one half look different than the other half? The border, so you want, normal moles have a smooth border, but if the border becomes very irregular, then we're worried about the color. So changes in color, or a new dark mole, something new, but also variations in color. One half of the mole is darker than the other half. Diameter, so anything bigger than a pencil eraser, the tip of a pencil eraser, doesn't necessarily mean it's bad, but again, that increases our we're more suspicious when they're very big moles. And anything new. So if you say, I never had this mole before and I got this brand new black dot on my leg, that is, I don't love new moles. So, not all new moles are bad, but anything new, definitely see a board certified dermatologist. That's really, really important. I keep emphasizing that word board certified dermatologist because we did our entire training to evaluate moles. And, there's lots of things in dermatology, but that's a big, big, big part of it. So see a board certified dermatologist if you're suspicious.
Really quick, just on that subject, my whole family, we get it from my mom. We all have a ton of moles, and I've had one removed. But also something a girl asked, is it normal for your mold to have longer and darker hairs coming out of it? That's just, I know it's kind of, I don't know what that is.
Yeah,
but
that's a great question. So, we used to always say that if they had hair growing out of it, that was actually a good sign, because theoretically, if something is cancerous, it wouldn't be healthy for hair to grow out of it. Like, it wouldn't be differentiated enough. So we used to always say that was a good sign. And I think generally it is, but the key take home is always see a board certified dermatologist. Because let's say you got a brand new black mole and had a hair growing out of it, I would still biopsy it if it was and it was irregular and it, met all of these criteria. So the key is that clinical skill of a derm.
Doctor?
Yeah, because I have this one on my face, and I've had it since I was a kid. But that one, I always have to check and make sure there's not like a long hair out of it or anything. I might get it removed later, but yeah. That was something people had asked me.
Yeah, it's very common for those moles. We call those congenital nevi, the moles that you have on your face that you have from birth. So common for those to have hairs. It's
it's a beauty mark. I mean, there's supermodels who have made tens of millions of dollars, right?
Yeah.
So we worked with Cindy Crawford, I think, in the last year, shooting some stuff with her, and she's one of the most beautiful women in the world and very real. And, I mean, we certainly don't think anything is wrong by any means. And I think one of the things that is special about her, frankly, is I've read in magazines and over the years, I didn't ask her this when we were working with her, but she's referenced that her mole was one of the things that she thought impacted her and made her more authentic and real to people. Lauren Hutton, that I doubt Rachel remembers who she is or knows, and I don't know if Dana does. I'm sure Dr. Heather does. Is an amazing woman, one of the, just beautiful inside out. And I mean, the space in her teeth. And I remember her, she became so iconic, so spectacular. And she had said to me many years ago that the modeling agencies, when she started, pressured her, if you just fix your teeth, you can really go to the next level and not have that little space. I said, this is me, this is my look. And then she kept it and became Lauren Hutton. And then years later, you had people who were adding a space, faking it to, try to make it seem like it was, a special beauty look. So I think one of the messages, and I think, Rachel is the epitome of this, and Dr. Heather and Dana, and everyone here on this podcast with us today, all three wonderful women, is that authenticity is always in style. Authenticity is a wonderful thing. And I compliment all three of you for that. Very much so. A ton of respect for all three of you ladies. Dr. Heather, do you have anything you want to ask or add before we toss it over to Rachel to say anything to her legions of growing TikTokers?
Well, I just want to thank you for having me. This has been so much fun, and I love talking to all of you because you're all very fun, normal, relatable people. So I love that, because that is, what I think, like I mentioned before, what drew me to TikTok is that it has real people and, with real problems and real funny stories and interesting stories. And so I have had a great time, and thanks for having me.
Absolute pleasure.
And by the way, we did add in Dr. Heather and Rachel's handles into the chat box in YouTube. So if you don't already follow them, you can, and make sure you hit subscribe on our podcast page.
That is wonderful. We want people to know where to find them and get them. Yeah. And piggybacking off of what Dr. Heather said as we threw to Rachel, one of the quotes that I've been floating around in my mind a lot lately, it was attributed to Ernest Hemingway, but then there's a lot of drama about it. It might have been Leonard Cohen, so now they say it's both of them. But there was a saying of that, and I felt it was very appropriate right now in this time we're living in, that we're all broken. It's how the light gets in. And I don't know if you've heard that previously, but and I read that, and I thought it was really, really interesting, going back to that being real and just being open and honest about stuff. It's not even okay to be broken. It's normal. It's a good thing. We are absolutely all broken. I'm happy to say I certainly am. And geez, anyone who knows me, that's probably the kindest thing they'd say about me.
And we're human. We're made to be different.
Right. So that's right, and that's what's great. So especially if anyone is watching this, and again, I'm sensitive to how many younger people are watching this, younger ladies, I'm sure some young men, anyone who's older, who's feeling down. We talked about some serious topics today as well. You know, I hope those words are helpful. I remind myself of them every day. You know, we are all broken, and it's what lets the light in. It's what makes us special if we're open about it. And Rachel, that's a perfect segue to throw to you to wrap it up, because you are in my eyes right now the queen of authenticity, and why TikTok is responding to you the way it is, which I think is wonderful. So we'll give you the wrap up here, if you would.
Yeah, so I just want to thank Dr. Heather for taking time out of your busy schedule. I just want to remind girls, doctors are there for you. They're not against you. They're not there to make you feel uncomfortable. They're there to tell you that what things are normal and what things aren't. And I totally appreciate everything, and being on this podcast and being here. And I'm glad we did talk about the sensitive subjects, because a lot of girls that, you know, growing up, I didn't know what depression was. And a lot of people in my family have clinical depression and things like that. It's just genetic. And I think it's good to talk about how it's normal, especially in this pandemic, to feel down and to feel sad. Like you're not doing anything wrong for feeling that way. And you're not weird for being a certain way. You're not weird for, having hair here or hair there or whatever. It's just, and that's why I'm glad we had Dr. Heather here to tell us, that is normal or that isn't normal. And go talk to a doctor about this, go talk to a doctor about that. Or if you can't afford to go, here's some advice, you can take. And that's what I'm here for, is to just help the girls out there who are too uncomfortable, too shy and things like that. So totally appreciate being on this podcast and the opportunity you've given me. I look up to all of you. So
I look forward to seeing you a lot more and following you. And I may be your oldest follower at this point, but I will be watching it. I'm very excited and interested to see everything wonderful that happens for you. Dr. Heather, longtime friend and someone I've been very fortunate to work with over the years. We'll do it again soon. You're wonderful and kind and gracious with your time, and wonderful in all things that you do, and a busy mom. Your patience, you teach. So the fact that you found this time for us, we appreciate. And Dana, wonderful having you on this one as well. And I am sure you are a tremendous big sister. I've met two of your three sisters, and I know how highly they think of you. So you've clearly done a very wonderful job as a big sister. So
I love them very much.
Thank you, everybody, for watching. We have some really cool topics coming up. We didn't put a teaser together for them, but oh man, in the next couple of weeks, next week and the week after, are two of the most cool podcasts that we have ever done. Now that we somehow figured out this whole live thingy, away from our other day job of making commercials, maybe we'll do the live thing more often. So keep checking us out as Not Seen on TV and YouTube, right? Or as Not Seen on TV at YouTube, or whatever else is in our chat box. I'm never good at really promoting
YouTube.com/as Not Seen on TV.
You see how authentic we are? We don't even know how to promote ourselves. We're so bad at that. All right. Thanks, everybody. Take care.
Thank you.
We'll talk to you guys soon. Be safe. Bye. Goodbye to everyone. Thank you.